I joined the NHS in 1980 as a NHS management trainee. I believe in its purpose, delivering care to patients every day, and the NHS being free at the point of delivery. And here I am 38 years later, and it's a privilege to be Chief Executive of Barts Health NHS Trust.
It sounds a bit cliche, but I wanted to do something where I felt I was helping other people. I hadn't heard of occupational therapy before, but I incidentally met an OT who explained to me that OTs ask people what matters to them, not what's the matter with them. And this really struck a chord with me.
I've always had this thing about helping people. As I'm not academic and I couldn't be a doctor or a nurse or technician, I thought working as a porter would be the next best thing.
When a close member of my family was diagnosed with a terminal illness, the kindness of the NHS staff and the quality of care that was provided was great, that I wanted to become part of this honourable and admirable team.
One of my best memories is of a 90-year-old man who had a triple valve operation. He was on death's door beforehand. And when he came to, the first thing he said was, "You guys are all magicians." And that really struck a note for me that we're actually doing a lot of good for our patients.
I've got so many fantastic memories of working in the NHS. One really comes to mind now. I had the opportunity to actually take a patient with me to a different hospital for a procedure. And when I got there, I was all she had. She wanted me to go to the theatre with her, and I did. And all through her procedure, she held my hand, and I felt there was a connection, and that meant a lot to me.
There's lots of inspiring people that I've worked with, but the people that have left the biggest mark on me are some of the people I've treated. There was one particular patient who came in with very bad pain and disability in her shoulder, and it really affected her whole life, and it was very difficult to see a way forward for her. The effort she put in alongside us, it just gives me the inspiration to really help people as much as I possibly can.
Our senior leaders that we work with at Barts every day have been really inspirational in taking an organisation that 3 years ago was pronounced as being under special financial measures and special quality measures, and seeing that ship being turned around and seeing our markers of quality going up through the quality spectrum has been really motivating for me.
I'm really proud to have been involved in a really innovative project. We created these day rooms for patients here at the Royal London. They now have access to a garden room and a cafe style room, which gives them a space to get away from the bedside and have somewhere to relax and socialise. And I get such a great feeling from seeing patients use these rooms.
My hope for the NHS in the next 70 years is I hope and pray that NHS continues to survive. And there has to be some evolution, people taking responsibility for their health through public health initiatives and education.
I was actually born on the 7th of July 1948, and NHS came into fruition on the 6th. I'm sure my mum and dad worked it out, so I got born for nothing.
My hopes for the NHS is it goes on delivering amazing and transformational care for London and throughout the UK every day.
We know the NHS has changed a lot since its inception, and it will continue to change. But I'm confident that over the next 70 years, Barts Health NHS Trust will play a really important role in the delivery of fantastic care.
Barts Charity has supported the NHS for the last 70 years, and we're so excited to support the NHS for the next 70 years. We've given 100 million over the last 5 years to support the incredible work of the hospitals of Barts Health Group, and we want to give similar levels in the future to boost the extraordinary services and people who work here on a daily basis.
Happy
70th
Birthday.
NHS.